Okay, good afternoon, everyone. So my name's Claire Lowe. I work for Bristol Health Partners. And just before lunch, we're going to tell you about the work of the Bristol Health Partners Healthy Weight Health Integration Team. So I'm going to do the first part, and then I'm going to hand over to my colleague, Karen Coulman, who is one of the Healthy Weight HIT directors. So firstly, what is Bristol Health Partners? Well, at Bristol Health Partners, we unite organisations and communities in healthcare research, planning and practice, and we aim together to bring about changes that improve the local health and care system and hopefully help people in the local area to live healthier and longer lives. And everything that we do is driven by evidence, improvement and fairness. So firstly, evidence. We use evidence from research and we share it with those who plan and provide health and care in our region and beyond. So this means that decisions made are evidence-based. We study what's happening in health and care practice, and we help prioritise areas for future research. Secondly, improvement. We bring about evidence-based improvements to local health and care, and we support training for people to implement these changes. And finally, fairness. We work really closely with people with lived experience and also people from diverse communities. And this ensures that health and care in our local area is more accessible and equitable. So most of what we do with Bristol Health Partners is done through our health integration teams. We call them HITs for short. Our HITs connect people. So people within BNSSG, we've got academic researchers, we've got people who work in healthcare, so clinicians, we've got public health, and also really, really importantly, those lived experience voices. And each HIT focuses on a different health or care challenge. And these are always in line with ICB priorities and driving change. So the Healthy Weight HIT. The Healthy Weight HIT is a group of individuals with a shared interest in the prevention and treatment of obesity and in translating research in this area into practice. The Healthy Weight HIT brings together experts from across our region. These include members of the public, so the lived experience voice, researchers from academia, public health professionals, and finally, clinicians. So who are the Healthy Weight HITs? Well, the Healthy Weight HIT is headed up by a group of directors, nearly all of whom are actually in the room today, and most of them are presented this morning. So first of all, we've got Karen, who's I'm going to hand over to shortly. Then we have Ruth Mears, a clinical research fellow. She wasn't able to join us today, but I think many of you know her anyway. Julian Hamilton-Shield, who we've heard from this morning. And then we have Justine Womack and Sally Hogg, our public health consultants. And again, we heard from Sally this morning. And we also have the wonderful Lou Lacey, who gave a lovely talk earlier, really, really powerful. Thanks, Lou. And Lou is our peer co-director, and she brings that really important voice of lived experience to our HIT meetings. And finally, myself. So I'm now going to hand over to Karen to explain some specific activities that the Healthy Weight HIT has been involved in.
Yeah, so I'm just going to give a flavour of a few of the things that we've been involved in as a HIT. You know, we're not a research project. We're here to connect people and think about ideas for new research and how we can translate research. So I just want to show you a few things that we've been involved in. So one thing that we do is working with local organisations to take part in community engagement events. So particularly we've been working with Sorona, which is a local organisation that delivers health and care. And we took part in a Somali Women's Health Day, a South Asian Health Day, a Muslim Women's Health Day. We've got a few more booked in the diary. And what we've done is we've offered people weight, height, and waist measurement checks. And And when we first started doing this, we thought, oh, are people really going to want to come and have their weight checked and actually have a conversation about it? Is it too sensitive? Weight stigma? And we were told by the organizers, no, people should, people want to have the chance to do this. They want to be given the opportunity. And every single event we've been to, we've had a queue of people lined up to see us every time. We haven't been able to have a drink. We haven't been able to go to the loo. We've just had queues and queues of people. So I think it's really powerful to show that, people aren't getting a chance to talk about their weight or even get their weight measured in general healthcare services, unfortunately. And but I think it just shows how keen people are to talk about this. We've also worked hard to try and find some specific resources, culturally appropriate resources. So this is just a few examples of things that we've brought along, and we've really found that the visual resources, so preferably no words whatsoever, seem to be the ones that people are most interested in and that make the most sense to people. So like back to the old plate model, very simple model, seems to be the thing that most people have really engaged with. That's just an example of some events that we take part in. We're also, so through our PPI group, so the HIT has, so we have a peer co-director, Lowe, but we also have a specific PPI group for the HIT. And one thing that's really come up that, is around language and how what words we use to talk about weight and obesity. And that just was a theme that just kept on coming up in every single meeting we had. And we looked at the NHS BMI calculator, which is one of the most used tools on the NHS website. And here you can see that, even though person first language is supposed to be what we're doing now, it comes up and says you are obese, you're in the obese category. So we have made contact with people at NHS England who are responsible for the healthy weight or the BMI calculator tool, and they're interested in working with us. So we're doing some work. Yeah, we're doing some work around this, and we've got a little bit of funding towards this, and I'll talk about that next. So we managed to get some funding through BNSSG, which for those who don't live locally stands for Bristol, North Somerset and South Gloucestershire, through our Integrated Care Board. So it says under review, but actually it's been successful now. And that is to work with our PPI group around doing some more stakeholder engagement around inclusive health, culturally competent approaches to overweight and obesity in diverse adult populations. And this was very much like, we did not come up with this. This was our PPI group who wanted this done. And so we're hopefully going to write up a bigger NIHR grant application around this area. And working with King's Health Partners as well, who are also doing some work in this area. Sally earlier today spoke about the Why Weight Pledge, and we together HIT co-directors and Becky, who's here today, Becky's co-leading the evaluation of the Why Weight Pledge, and that's funded through the NIHR. And these are just all the different partners who are involved in that. Also, I was involved in a project to develop some national e-learning for carers on how to support healthy weight in people with learning disabilities. And that's a free program that anyone can access online. And that was underpinned by research. And we worked very close with policy and voluntary organizations to create that. And I'm just going to skip that page just because we've been talking about GLP-1 medications all day. I'd also mention that myself, Lowe and Ken are all involved in an NIHR evaluation of the real world evidence of how the GLP-1 medications are being rolled out in the NHS. And that's a 3-year study, so more to come from that. Hopefully I'm within my time. Thanks.